So today is Sunday, and it's August the 21st, 2022, and it's a few minutes after 5 o'clock Eastern Standard Time. My name is Jonathan Jones. It's my pleasure and privilege to be your host and moderator for the afternoon. You've been invited to what we call our Healthcare Support Association weekly conference call. We talk about a variety of health topics. You're welcome to join us any Sunday at 5 o'clock. If there's something of value, something that you find beneficial to you or to someone that you care about. The information we provide is all part of the public domain. It's public information. There's nothing proprietary here. I'm not a medical doctor. I strongly recommend that you seek the competent medical advice of professionals that you trust. Don't take anything that you hear discussed on this program today as is to be construed as a substitute for a visit to your primary health care physician. We strongly recommend that you seek the competent medical advice of professionals that you trust. Please don't do anything I say because I say it. When Dr. Prasad answers questions or does his portion of this presentation today in this conference, as we're having a discussion about gut bacteria, Dr. Prasad is not a medical doctor. He's a scientist, brilliant scientist. Now, doctors and other professionals would resource his discoveries and information that he's had published. And I will tell you a little bit about Dr. Prasad here in just a moment. In fact, I'm going to introduce Dr. Prasad to you by telling you a little bit about the brilliance of the man. And I like to do this because I think it's critically important that everyone understand that we're not just having a chat with any old doctor here. It's not just the average scientist. Dr. Prasad's accolades are quite extensive, and I think it merits giving it some attention. Dr. Prasad was a professor at the University of Colorado, the School of Medicine, for more than 30 years. So he's done research on vitamins and cancer research. He was also the president of the International Society of Cancer Nutrition, member of the British Society of Medicine. He was invited to be a Nobel Peace Prize nominating committee in the category of medicine. Now, Dr. Prasad became the world's first radiation biology PhD. He got that in 1963 with a 7-year course. He completed it in about 3 years, half the time that it would normally take for anyone else. So that's the level of brilliance that we're talking about. He's been awarded 7 US patents on micronutrients, and we may touch on 1 or 2 of them. That's not the focus of this discussion today. The focus of this discussion is not those patents, but you need to know that they exist. One of them has to do with the treatment of diabetes. Another has to do with pulmonary and heart health. Another has to do with repair of DNA damaged by low-dose ionized radiation. Dr. Prasad has made some incredibly amazing discoveries. The National Institute of Health has awarded millions of dollars for research, and $12.5 million was awarded by Congress to do research into the micronutrients that Dr. Prasad has released onto the market. In fact, MicroDaily, which was formerly known as MMF, has some $24 million of research funding behind it. Dr. Prasad has been published some 250 times. So as far as scientific papers are concerned, Dr. Prasad has discovered and has been credited with the first person to make the science community aware of 250 different things. I'd like to draw your attention to one of them. Now, I'm just putting a little red line by this one item there. Dr. Prasad discovered that vitamin E succinate is cytotoxic to cancer cells. That means it will kill cancer cells. This is the gentleman that figured that out. Now, that may sound like a small thing, but I assure you that it is not. There are at least 6 different types of vitamin E. I didn't know that until I became associated with this man. And but my thinking is that if you have to have a vitamin E in your body, which we all need it might as well be one that's cytotoxic to cancer cells. It also has the unique property of being able to cross the blood-brain barrier. So if you got vitamin E going across your blood-brain barrier, it's nice that it's going up there and getting busy and taking care of more than just free radicals. As important as it is, it has the ability to take care of some abnormal cells as well. So he is the one who discovered that vitamin E succinate is cytotoxic to cancer cells. But take note of this one because this kind of speaks to our subject matter for today. Dr. Prasad discovered that butyric acid, the small fatty acid formed by the fermentation of fibers in the gut, is an anti-cancer agent. Dr. Prasad knows something about the gut. This man is the scientist that made that discovery that this butyric acid, a small fatty acid formed by fermentation of fibers in the gut, is an anti-cancer agent. We need his brilliance. And we're very fortunate that we have access to him today. He has authored some 31 books, authored or co-authored 31 books. He's currently working on his 32nd book at age 87. He's almost 88. So at that young age, he's still very active and very busy. So Dr. Prasad, it is my pleasure and privilege to welcome you to our discussion today. And we thank you very much for taking out time of your busy schedule and making yourself available for us to have conversations with you today. So let's see if we can't unmute Dr. Prasad and bring him into our discussion here.
Thank you, Jonathan, and thank you to all participants who are gathered together on Sunday afternoon. And so it is my privilege to talk to you, and if you have any question, you can ask it.
Oh, Dr. We're going to have a lot of questions for you. I have a few slides that of things that you've already talked about.
Thank you.
And I'm just looking forward to your enlightening us. That's really all we want more than anything. So I'm almost just going to want to push your play button, and we're just going to sit back and shut up. Because by the way, if you search PubMed, you'll find Dr. Prasad will show up in there at least dozens of times, if not hundreds of times. He's referenced in all kinds of papers in PubMed. So he's the go-to as far as scientists are concerned. So Dr. Prasad, tell us this. I just did a quick search this morning to just see how much bacteria make up the human body. And the research that I found said that there's 10 times more bacteria than human cells in the human body. And that's based off of something here from the National Institute of Health. So we're talking somewhere in the area of 100 trillion bacteria versus 10 trillion bacteria make up a human. So you're telling me I'm more of a bug than I am a human? So I'm more microbe than I am human being. So that's a little bit unnerving from my point of view. So, but it's a good thing, I suppose, right?
Yep. Okay.
All right. So it's a good thing. So tell us then, Dr. Prasad, there's some good guys and some bad guys in this whole bacteria world.
Yes.
And as I went through your whole presentation that you did a couple of weeks ago, I saw the word immune system come up over and over and over again. Can you just kind of break this down for us a little bit and tell us a little bit about this? And I see your discovery is mentioned right off the bat there, this thing about butyric acid.
Yes, I think, intestinal wall also had a lymphoid system, which is one of the immune response that we get, host response. But intestine has also immune system, and on host immune system, peripheral, they're all linked together. And so bacteria produces certain vital molecules, for example, anti-inflammatory cytokines, which stimulates the not only intestinal immune system, but these molecules can cross and go to the bloodstream and stimulate also innate immunity, and then they cell a lot of macrophages and natural killer cells. So probiotics plays a very central role in maintaining not only the intestinal immune system, which is very important to maintain the gut health, but also it can influence even the brain. Through the brain axis, gut-brain axis, it can influence the function of the brain. And it was very interesting to note that even in a chronic Alzheimer diseases, for example, Alzheimer, when they measure the probiotics in the gut, they found that the proportion of the good bacteria markedly decreased. And so even in a that disease process, in other words, they are so much linked that even the bad bacteria proportionally is more than good bacteria. They can influence your brain function. And good example I gave you is Alzheimer's disease, probably other diseases, brain diseases as well. And so maintaining a proportion of good bacteria is extremely critical for many, many reasons. And also for, of course, immune system plays a central role to prevent any kind of infection in your body. And that's why, and also that, when your gut is healthy by the help of probiotics, it can absorb the micronutrient that you take. And for example, either micro daily, brain boost, or eye boost, they can be absorbed and transported more effectively to various organs in your body than if your gut is in not a good shape.
I would imagine that would be a critical thing. Dr. Nakuzi was the one who said to me that that gluten builds up on the surface lining of the gut like a paste. So yeah. It's the good bacteria that eats up those things that reduce the nutrition absorption area, surface area of our gut.
Yeah, if you have too much, if you have too much overgrowth of bacteria in a certain condition, that could interfere with the intestinal health for the same reason, because they will start producing some molecule that may be toxic, and that can interfere with the function. But intestinal brain barrier is very, very important, because that makes a difference. And this barrier, if it gets disturbed by, say, inflammation, then many toxic chemical and some unnecessary material can get into your bloodstream and can cause all kind of health problem. Wow. And so to maintaining the integrity of the intestinal barrier is extremely important. And probiotic bacteria, because they form the colony, they produce then by producing a lot of mucus and other things, many things act as a barrier. And these epithelial cells in the intestine are hooked so close together, and that acts as a barrier, so no toxic chemical can get in your bloodstream. And what happens in a inflammatory disease of the intestine, this barrier, intestinal barrier, becomes permeable to many bad bacteria, things like that, and that creates a lot of inflammation centrally as well as peripherally in the immune system.
Yeah, I was kind of curious. That was one of my questions I was going to ask you, is where would this bad bacteria come from? Are we just talking about like E. coli or salmonella or something like that? Or
sometimes, some of those bacteria exist there, but they are in a very minority. And good bacteria sometimes, for example, they exist there, but sometimes you can take from the food bad bacteria. But if there are good bacteria already present in your gut, then they prevent that they can form colony, because they compete for the same site, and good bacteria is more effective, and therefore they don't give any place for the bad bacteria to grow. And so that's why it is so important to have a probiotics with prebiotic, and butyric acid that you mentioned. It not only acts as an anti-cancer, but it also improves the function of the intestinal wall. In other words, it strengthens the barrier of the intestinal wall so that nothing can get in. So it has a multiple function. And if you go to a PubMed, you can get a 500 or more paper on a butyric acid. It's not only an anti-cancer agent, but it stimulates the immune function, in the brain function, and so on. You will have cardiovascular disease. And also probiotic. Now I was doing some research. They also have not only a gut-brain axis, but they claim they also have a gut-lung axis because of the inflammation, because of its role in immunity. And some of the, for example, if you don't have probiotics, good probiotics, and then you can get easily infected, and then you have a problem. But if you have a good probiotic, it can send a signal to the host that it can produce a molecule that can send a signal to the host to produce a macrophages, neutrophil, and take care of the viral infection. So
Interesting.
it is also very important that probiotics also maintains the function. It plays an important role in maintaining the function, and it helps host to monitor if there is any foreign infection has occurred.
That's interesting. So you just made me think about some of the challenges that Joanna, my wife, and I had. She had terrible leaky gut syndrome.
Mm-hmm.
And she began to suffer. Once we got the leaky gut under control, she suffered with SIBO, small intestinal bacteria overload, horrible bloating. And
That's classical
Dr.
symptom.
Prasad, it made her breathing almost asthmatic. Every time we went to the doctor, sometimes I'd go in the middle of the night to the emergency room and they said there's absolutely nothing wrong with her. She doesn't have asthma, but she couldn't breathe.
Yeah. See, that's the point. If your gut, the bacteria has been disturbed, they can affect all kind of organ function, especially brain and lung, for which we have a lot of data. And so the best, and also when you have a leaky gut and you saw the bloating, gas, and sometimes diarrhea and so on, and also mentioned about the lung, and the intestinal, the reason is because the intestinal barrier becomes highly permeable. So not everything can get in because it is damaged by inflammation. And so when you have a good bacteria with probiotic, if you take it, then they started strengthening the intestinal wall, creating atmosphere where healthy intestine is there, and then inflammation get down, and then there has been a clinical study that at least the two strain of bacteria that we have, Bacillus coagulans and a Saccharomyces boulardii, they too are extremely helpful in improving the symptoms of leaky gut. And because they are strengthened, one of the major things that they are no more permeable. Intestinal barrier is no more permeable, it becomes strong. So whatever happened, they gradually symptoms subsides.
Yeah, see, I had no idea that there was a connection between bacteria and leaky gut. I did that. I searched it. I actually went to PubMed to see, and you were right. There's an article there that says that the good bacteria can have a positive effect on leaky gut syndrome. But I had no idea, so I feel so ignorant.
Yeah, no, but I mean, one of my job is to trying to find out and what's going on and tell our listener what I know, what I have learned, what I have myself learned.
Well, you're doing it for us there, Dr. Prasad, no question about it. So that's a beautiful thing. So then tell us then what causes what can cause the gut biome to go off? The picture that I'm trying to slide to.
Well, it could be a poor diet, like if you take a lot of sugar, a lot of fat, a lot of poor diet can deplete the good bacteria, and then certain amount of harmful bacteria is always there, but they are in balance. They keep in check. But when you have a bad diet and other things, that can aggravate it, and so then the bad bacteria take over, and then you have to take a replacement with a good probiotics, which can again replace those bad bacteria and take over, and then perform the function to help in this kind of a health situation where you have a inflammatory disease of all kind in the intestine.
Mm-hmm.
And plus, possibly it has an indirect role in other organ as well, like a lung.
You said bad diet. Did you say fatty foods and sugar? I think I saw that on the slide.
Fatty food and sugar.
But that's everything, Dr. Prasad.
Yeah, I mean, you can take a small amount of sugar. I mean, sugar is very important on your brain function. The glucose is used to generate energy. But what I mean sugar is the excess sugar.
Gotcha. Okay, so don't go overboard.
Yeah, I mean, a small amount of sugar is extremely important for your health. But it is just like free radical. A small amount of free radical is very important for your health. But if you produce excessive amount of sugar, I mean free radicals, that is very damaging for your health.
Okay. I have another couple questions here for you right along that same line.
Sure.
I'm trying to bring up another slide here because I really want you to comment on this. But tell us a little bit while I'm fighting with my little technology here. Tell us a little bit about this heat resistant and acid resistant strains that you chose.
Yeah, I think the regular one is the two-strand Bacillus and Bifido, which you get kind of in a yogurt and every place else, and all the commercially sold formula. But this Bifido and the Bacillus strain of bacteria are very sensitive to heat and acid. So if you take orally, then they will be destroyed in stomach acid pH, and are also when you travel it, then bile acid is in intestine, and so that will be degraded. And in intestine is 37 degree, which is also a little warmer. Part of them is degraded. So by the time you go to lower corner, there are a few viable probiotics are there. So I decided that let me find out some acid resistance and heat resistance probiotics, and found out that Bacillus coagulans is a acid resistance and heat resistant bacteria, and this is the only bacteria that was approved by the FDA to give to infant formula, because as you know, infant intestine is totally sterile. There is no bacteria or any kind of things, and so that's why they gave it, so that no harmful bacteria can colonize the intestine, and then baby can grow normally. And with our formula, we have added a Bacillus coagulant. Second one is not of bacterial origin, it is of yeast origin. And this is called Saccharomyces boulardii. And they are also very heat resistant and acid resistant. And they picked up both because the combination, there have been individually a lot of clinical studies showing that it helps in an inflammatory bowel disease of all kinds, Crohn's disease, irritable intestinal syndrome, leaky gut, and so on. And so, because they're all related to inflammation, and a good probiotics like we have can reduce inflammation in the gut, and therefore it can improve the symptom of the disease. And so this way, our product is unique because not only we have given a regular one like Bacillus strain and a Bifido that are normally present in our gut, we added a two additional one, which are acid resistance and heat resistance. So they can go, and they don't stay in the gut for a long time. After 5 days, they get eliminated. They did their job and let good bacteria grow, much higher proportion than the bad bacteria, which are always there.
But that's fascinating to even contemplate that there's bacteria-specific ones that can survive the heat of the body,
yes,
and can survive the acid in the gut.
Acid in the gut, right?
So why are we wasting money on all these other probiotics, Dr. Prasad? Because
I don't know. And this is a good question, Jonathan. And I think that's why I didn't. My wife had some problem, and so her doctor recommended a Saccharomyces boulardii. This was prescription one, but it is not anymore prescription. But he gave a free sample, and so I said, and then her symptoms some improved. But so then I said, yeah, I think this is a good idea. So I did some more research and found, yeah, it is a very good one. And then I did also research on a Bacillus coagulant, and I decided that these two will sustain acid, and therefore, in a way, it will protect the other acid-sensitive or heat-sensitive bacteria which are also there, because it becomes a competition. If they are protecting it, so they're more viable bacillus and bifidobacteria can go to the lower colon where they reside most of the time.
Okay. Because I was under the impression, the research that I dug up, that you needed to have like 50 billion international units of probiotics almost daily if you had some gut problem. But if I'm understanding you correctly, especially based off the previous lectures that I heard, that 50 billion number is not true. It's having the right bacteria is more important than having that quantity.
Yeah, I mean, 50 billion, if you give them and 90% is destroyed, and so it is not
90% destroyed.
by the time go to lower colon. So what you are going to do? So that's why they are not very effective. I mean, they have some effect, but not very effective. But when you add the heat resistance and acid resistance, then you are going to have good bacteria. And these two bacteria then get eliminated. Bacillus did you know Bacillus coagulant has been isolated from soil? So some of the kids are playing with the dirt, it's okay, because they get some coagulant.
So we were doing ourselves some good when we played in the dirt back when I was a kid.
I played a lot in the dirt when I was in India, so that's why I'm so resistant to any infection.
In Georgia, I would go visit my grandmother and great grandmother, and I hate to say it, but the orange clay actually tasted pretty good.
Yeah.
Sorry, folks, I didn't have that much sense back when I was a kid, but now it sounds like I was brilliant.
Yeah, so I mean, so Bacillus coagulant resides there in a soil, so they have been isolated from soil. But in any way, so it is important to maintain okay. So gut-brain axis is very important. The vagus nerve, you are seeing it. So when vagus nerve goes from the brain to the intestine, they bifurcate in millions of fibers, branches, because it has to cover the whole intestine.
Yeah.
And one cannot. So they send message back and forth that if this is a bad news or good news, and good news would be that the probiotic bacteria are generating a lot of neurotransmitters, which is important for the brain, and also precursor of neurotransmitter like dopamine, serotonin, and glutamine, and so on. They are very important neurotransmitter. And so if they're sending this, so the brain can be happy. And if brain feels, suddenly suppose if a brain inflammation happens, it sends a signal to probiotics to produce some good inflammatory product like anti-inflammatory cytokines, so that they can help to fight the infection. And of course, in a brain, we have a microglia cells which then get activated and start producing anti-inflammatory cytokines to get rid of inflammation. So these two are very, very important message. And now I said that, similar kind of axis exists between a gut and the lung, which I didn't know that. So to maintaining the good health of gut health is extremely important for overall function. And I think that's why a probiotic with prebiotic that we have developed is going to be a vital important for your health.
Dr. Prasad, you just said a mouthful there. The immune system is in the gut. Everything about the immune system is in the gut. And now with all this bacteria, it has a direct impact on the immune function and the brain connection.
Right.
So is that the reason why if a person is living in a high stress environment, they're prone to get very ill?
Yeah, stress, because once you change, not only that high stress can produce a lot of toxic chemicals from your brain and but also the relationship between a good and bad bacteria in the gut get disturbed. And so you have more bad bacteria producing all of toxins, a product, and therefore you feel more stressed. And so I think, indirectly, since it affects your autoimmune system, it can improve or it can decrease your mood or digestive system or psychiatric problem. And so intestine plays a very, very important role. And that's why I said that happy gut is a happy mind or happy whole body.
That's interesting. I saw a documentary once. Maybe I don't know if you've ever saw it. I'm just going to hit you blind on this one. But they did something called a fecal transplant.
Yeah.
The person was extremely ill. I mean, and nothing was curing this person. So they did a total fecal transplant. They took the feces of a healthy person, and basically, I'm going to say transplant because I don't want to sound disgusting the way that they did it. And
I
transferred
know
it
that.
into this person who was sick, and about a month or so later, all their disease was gone.
Yeah, I mean, that one of the major factor was the good bacteria there. And
Okay.
and so that's why I said that if you have a good probiotic with prebiotics, it can play a lot of maintain your gut health, and thereby you have better digestions, better absorption of nutrient all around. You are in good health.
So you don't recommend the fecal transplant. It's better to take it this way than to do it that way.
Yeah, I'd rather have a probiotic way, directly taking orally, acid resistance and heat resistant.
The fecal transplant was oral too.
Huh?
The fecal transplant was oral.
I would not recommend anybody.
Okay, all right, good. Tell us about the prebiotic then.
Yeah, prebiotic is like a soluble fiber and carbohydrate, and bacteria it is like a food to us. We eat regular food. For bacteria, prebiotic is kind of food. In the environment, they can grow nicely, and they also they provide a fermentation. So if you if you eat a food which are fermented, like if you go Korean food, you get kimchi, which is fermented, and some Indian spice, pickles are fermented. They are loaded with the butyric acid. Because they are fermentation products, so they are butyric acid, and so people who eat the fermented food is okay, is good health. But so prebiotic is very important. This is the time they generate butyric acid, and they help maintain the integrity of the intestinal wall so that nothing can get in. And as I mentioned, during fermentation, they also produce. It has a multiple function, but one of the important function is butyric acid.
Wow, I hope everybody heard what you said. If you go and you're out to dinner or something and they put a pickle on your plate, don't throw that pickle away.
Yeah,
did y'all hear this?
Pickle is okay.
Everything fermented.
Yeah.
Say that again, Dr. Prasad, about this fermented thing because of this butyric acid. Did you all hear this? You want fermented food?
Not too much, but I mean, if you take a probiotic bacteria, you don't have to worry about. But if you get a chance, if somebody serves you, don't reject it. But I wouldn't say that go and take daily fermented food.
Okay, it's not a bad thing because it's producing this butyric acid, and butyric acid has anti-cancer properties. Just remember that.
Many properties. It has a diverse function.
Wow. Keep that in mind, people. Okay, why acid-resistant probiotics matter? You commented on this already, right?
Yeah, I did.
So it's going to survive the gut, and you want the good kind, the kind that's going to survive the gut.
Yes.
So this is what we find on the market, and you commented on this during the launch there. How is it that you're saying here that your probiotic is in a class all by itself, Dr. Prasad?
But you can see that average one just has a probiotic 60 billion CFU. You sell it, you buy it, but nothing happens too much. Better product would be they have a prebiotic, but the amount of prebiotic is very important. Most of the product have a very small amount of prebiotic. But and so these are probiotics without any heat and acid resistance probiotic bacteria. So they are a little bit okay, but not very much. But one of a kind is our one, which has acid and heat resistant probiotic bacteria. So prebiotic can be used to ferment it, to produce a lot of good stuff. And that's why it is one of a kind. None of the product that I have seen in the marketplace, which has both Bacillus coagulans and Saccharomyces boulardii, they just had a bifido strain of bacteria 5, 6, or Bacillus, a few strains of Bacillus. That's all.
Well, I can tell you this, that it took us years to figure out what was going on with Joanna's gut. It took us years,
Yeah.
and I just wish that you'd gotten busy on this a little earlier, Dr. Prasad. So
Yeah, well, I didn't know that
yeah,
myself.
I'm
And the
not
thing,
upset with you now. I'm not upset, but I'm just telling you, it took me a long time to find out what was wrong with her.
yeah, I mean, I think David Nemelka asked me, say, have you thought of probiotic? I said, that's the most important thing, but I've never, you know,
Never had
uh,
a chance to focus on it.
focus on it. Exactly,
Mhm.
exactly.
Well,
And
we're
then,
glad that you did, and I'm going to say to just everybody here that's on the line now. I always say, don't do anything I say because I say it, but I'm telling you right now, pay attention to whatever this man's fingers has been on. If he put the formula together, there is something unique about it. There's something very unique about it. Look at the list in general of probiotic benefits. Is this the complete list of everything that the probiotics are good for, Dr. Prasad?
yes, improve gut health, decrease stress, depression, prevent attachment of harmful bacteria, correct? Reduce inflammation and improve inflammatory bowel disorders, improve immune function, enhance brain, and then like mentioned, organ function, enhance whole body health. I mean, really, if you think it, this is very, very important. And also important is your good diet, because if you misuse it, this may not be as effective as you like to.
Right.
If you eat a lot of sugar, a lot of fat, then the probiotic bacteria has to compete. And so I think I would say that, take a, average diet, reduce sugar, reduce fat, and that's all. Only two things, and do some exercise and things like that. And it's very good.
Well, I'm going to add one more thing to it, Dr. Prasad, if you don't mind. I'm going to ask people to be aware that weed killer is in the diet.
Oh, yeah.
So I hope you don't mind me just adding
Yes,
this.
no, I mean, you are correct. Many
Shoot,
places you have.
because of the GMO, right?
Yeah.
Okay. So they found out that there's 80% of all the grains that have Roundup in it. They tested it. 80% of all the grains have Roundup in it. So
That's terrible.
be
That's why
encouraged.
if you try to take organically grown food, that's important, but it's not always available.
That's the problem, and we try to be balanced with that, because I keep telling folks, go organic and non-GMO if you can, but at the very least be aware that if there is Roundup in that cereal bowl, be aware that you need to do something about it.
Right, exactly.
Make sure your immune system can handle it, because I found this list, Dr. Prasad. These are just some of the problems that come from having weed killer in your diet.
Oh, yeah. I mean, and they are not metabolized, so they stay to wheat killer, those things. And also those killer is also increases the risk of many neurological diseases, especially Parkinsonism. So you will see the many farmers who are exposed to this kind of, or those people who go and pick up grains are exposed to, especially during a spraying season. Later on, they develop Parkinsonism.
And this one here toward the bottom, the third one from the bottom, says disrupting your microbiome by acting as antibiotics. So weed killer can throw off your gut biome.
Yeah, definitely. Definitely.
And the next one down, impairing methylation pathways. Now you have you created the purple bottle is what we all call it, the methylated formula.
So they must also inhibit the enzyme MTHFR, which gets inhibited if you have mutation, but even chemical can inhibit it.
Oh my goodness.
If they inhibit it, then the folic acid or folate that you take from the diet can get methylated. And if they can't get methylated, you can form DNA or many other biological function interferes.
So did everybody hear that? What Dr. Prasad just said, at least, and correct me if I'm wrong, Dr. Prasad, weed killer in our diet can literally cause us to not benefit as much from the original formula. Yes. So the methylated formula puts us a step past weed killer. You understand me?
That's correct.
The methylated formula puts us past weed killer. So even if you do have weed killer in your diet, the methylated form of it helps you bypass the negative effects.
That's right. That's right.
That's why we have to keep bringing you back here, Dr. Prasad, because You just added a whole nother reason why we should make sure no matter what our situation is, we should at the very least go with the methylated formula.
Exactly.
Okay. All right. So gut biome, critically important. Some people look at this and they say, yuck. You should be looking at this and saying, oh my Lord, that's great. This is the most wonderful thing in the whole body right here is this image that we're looking at.
Yeah.
A healthy gut biome functioning properly. And listen, folks, I'm going back to this picture. Remember the image in the science brochure where we took the two lungs, the set of lungs from one laboratory rabbit that was zapped with both the rabbits were zapped with radiation. One of the rabbit's lungs looked like smoker's lungs. The other rabbit's lungs looked like this.
Yeah.
Dr. Prasad's formula helps our guts look like this.
Yeah.
Even while we're being zapped by radiation. So please remember that. And so we got Jackie Smith jumping out of her skin wanting to ask a question already. Hold on, Jackie. We'll get you first though, okay? So here's the lineup, folks, right there. There's the lineup. iBoost, the methylated formula is that purple bottle off on the left side. That's the one. Now the green bottle has all the patents on it, but the purple bottle stepped up and it's more absorbable. Methylated bees. So even if you have weed killer in your gut, even if you have weed killer in your diet, the methylated bees pass that. The purple bottle steps us past the weed killer that's in our diet. The red bottle on the far right, that's the EMF. That's the top shelf. That's the best one. That's the one that has 4 additional ingredients to fight the onslaught of radiation that we're being slammed with right now. So Dr. Prasad went to a whole nother level and put 4 additional ingredients in to protect us from 5G radiation. 5G, 700 times more radiation than the original cell phone technology. 700 times. Don't kid yourself. It's not just 4 times, 3 times, 5 times. 700 times more harmful. And the original radiation technology was like a microwave under your seat. Okay, that's how bad that was. Then there's the children's formula, the yellow bottle. The collagen, I cannot say enough about the collagen. And if I could get on my hands and knees and thank you, Dr. Prasad, I would, because what that is doing to folks' brain, all of this is helping the brain. I'm getting story after story after story of people whose neurological function is improving because of collagen, brain boost, and the EMF. Thank you so much for bringing these to the market. But even beyond that now, we have one more tool to help our brain, folks, and that's the probiotic boost you see on the right.
Yes.
So, don't take this lightly. Don't take this lightly. But get back with the person who invited you to this discussion, and they will help you to get access to Dr. Prasad's formulas. So again, I can't thank you enough, Dr. Prasad, for what you have done. Do you mind if we take a couple of questions from?
Sure, no, I'm glad to.
Okay, because we don't have time for a few, because otherwise we'll keep you here all afternoon and all night. But Jackie Smith was the first hand up. So
Okay.
And Jeff and Bernard, if you see questions in the chat, please bring those to the fore for us. So Jackie, please, where are you, Jackie?
Thank you, but you answered the question. My question was there a way to combat some of the
that weed killer
things that we, with the weed killer, but you answered the question with the MEF. So thank you.
Okay.
Thank you, Dr. Prasad.
Thank you.
All right. Song was next up.
Hey.
Hi there.
Hi.
Thank you for letting me ask my question. I just wanted to be clear on the EMF formula that has the methylated vitamin B12 and the folate, correct?
That's right.
Okay, thank you.
Thank you very much for asking that question, because I often forget to make that clear, because some people think that they need to go back from the EMF back to the methylated form. But every single one of Dr. Prasad's formulas is a step up. So the methylated, the purple bottle is a step up, but the red bottle has all of the technology of the purple bottle and then more. And also, Dr. Prasad, thank you very much for making sure that the children's gummies was
was built
off
very
the
important.
EMF formula.
Yes. Yeah.
So everybody needs to know this. the children's gummy is built off the red bottle. So the formula that's in the red bottle is what's in the children's gummy. So kids have maximum 5G protection. So that's good.
Yeah.
How do we say it, Dr. Prasad? Spare no
Yeah.
expense, like a scene from Jurassic Park.
Yeah, you can't get rid of the 5G cell phone, but you can protect it to
You can
extent,
protect.
you know.
Very good, very good. Michael Garlic?
Michelle, is it?
Michelle. Sorry about that, Michelle. I just,
Can't hear it.
okay, we need to unmute you so we can hear you.
Okay, can
Yeah,
There
okay.
we
you hear
go.
me now?
Yes.
Okay, hi, Dr. Prasad and
Hi.
Mr. Jones. I just wanted to thank you for your expertise and your passion that you have to help us live and feel a better lifestyle, which is truly a blessing to all of us. What I wanted to talk about, I had a few health issues in the past from like colon cancer, blood clot in my lungs, and last year, I have a picture here. I don't know if you can see it. This is I had surgery last October because my doctor told me that I had kidney stones, and I had like 15 of them, and 2 of them were the size of a quarter. And I know I was tired and it made me sick and everything, and I just didn't have any energy. And so I have a operation, a surgery next within the next couple of weeks. And they call it a dilated common a bioduct. And they said it was some type of stone that causing a blockage. And I wanted to know.
Uh-oh, what happened?
I don't know.
Hold on, Michelle, we lost you. Go.
Okay, can you hear me now?
Yes, you're back. Go ahead.
Okay, sorry about that. I have a surgery within a couple of more weeks, and they had did an MRI, and they found they said I had a dilated common bile duct or something, and it was causing a blockage. So they think it's a stone. So after I had my operation, I just wanted to know your recommendation or your input of what I could take, which one of your products after my surgery, because I know sometimes I had gotten an infection and everything. So I want to know what could I take to help in my healing process, because, you know, I know that.
At this time, looks like you are under a good doctor care, and continue to do so is a good idea. But in the meanwhile, I would recommend right now only to take micro daily EMF, and don't take right now the probiotics because of surgery. And anytime you have a surgical intervention of any kind or bleeding of any kind, I don't recommend that take probiotics. But for most people who have normal right now before surgery, at least it will give you some energy. And if some nutrient is lacking, this will replace it. And if there is a kidney stone, it is very easy surgery to remove it, and you will feel better.
Well, thank you so much for that, Dr. Prasad, because I was really nervous last year when I had my surgery to remove all the stones, because the doctor told me not to take any vitamins 2 weeks before. And I had been taking your EMF and a brain booster. And I was like really sad. And I said, well, you know, I was really in prayers that, you know, everything would be okay. And then I had to take a COVID test and before I could have the surgery, you know, so everything was negative. So
because I think that, for a few days before this surgery, doctor recommends you to stop any kind of blood thinner, and vitamin E, so for example, in this case, is actually a little bit blood thinner. So I think that recommendation is good, but you know, after that you take.
Well, thank you so much again, Dr. Prasad. And 6 years ago, I had lost my taste and smell from a flu vaccine. So that's why I wasn't, you know, believing in taking the booster shots and the COVID shots, but
Yeah.
your medicine have really been blessing me. So I thank you.
Yeah, thank
All
you.
right. Thank you very much, Michelle, for asking your question and for your comments. So good thoughts there. So that's kind of interesting. We could take a couple more here, but folks, if you'll keep your comments brief, then that'll allow room for more questions while we have Dr. Prasad. Okay. So Hannah.
Yes, thank you so much for this opportunity. I have been diagnosed with the good bacteria attacking the good bacteria.
Ooh.
And with that being the case, I have several appointments that I have to keep regarding that, but a friend recommended that I utilize this show, this opportunity to see which of those might be helpful for me.
Yeah, I think, in bacteria overgrowth, once in a while it happens in people, and this is because of the poor environment of the gut. So I think if you create a better environment of the gut, the overgrowth of bacteria may be reduced. And sometimes they give antibiotics, to kill some of the overgrowth bacteria. But if I would try this our product, and then probiotics, and then see how you feel, and maybe
Which one would you first
Beg your
suggest?
pardon? Before surgery, yeah.
Which one?
The
you hear me?
overgrowth of bacteria, right? That's what your major problem is.
Yes, lupus as well.
She's going to have a surgery, did she say?
No, she's did you say you're having surgery, Ann?
No, not. They
Okay.
suggested that I have surgery for something, but I'm talking about lupus and the good bacteria attacking the bad bacteria.
Right.
The good bacteria attacking the good bacteria.
Yeah, that's called bacterial overgrowth. It happens once in a while. And I think if you take a probiotics, and that will be very helpful.
Which one in particular?
We have only one kind, probiotics, prebiotic.
That's the formula here, the Dr. Prasad's formula.
Thank you. That's what I'm looking for.
Yeah, make sure you take that one, but also make sure that you're doing the micro daily. Are you taking the EMF?
This is all new to me.
Okay, so make sure that you get started on the micro daily EMF, the red bottle.
The red bottle. That's
Yes.
what I'm colors.
And also the green bottle here with the probiotic. So take that.
Thank you.
You might want to add to start to knock down your bacterial overgrowth. Start taking a little bit of it's called sovereign silver. You can take a little bit of that like every day, a couple
Sovereign
tablespoons
silver.
of silver. You could get that at any grocery store. And so add like a couple tablespoons a couple times a day, and it'll start knocking down bad bacteria.
Okay. Thank you so much.
You're very welcome. And we have Sharon Robinson has the question.
Yes, I want to know, when you see a person that have extended stomach, is that an indication of, I mean, it can be a liver problem, but is that an indication that the person has bad bacteria in their system, or gut bacteria, how you would say it?
I mean, it could be, the gut get extended. Maybe there's some gas and bloating, and under that condition, there may be a lot of inflammation in the gut. It is one of the symptoms of inflammatory bowel disease, but also it is a good idea to consult doctor if something else is there. And but bloating a stomach is very common if you have inflammation lot of inflammation in the gut. And under that condition, I think both a probiotic that we have, and I don't know if you take micro daily EMF or not, but both would be very interesting to see if that helps, and continue to check with the doctor, see if there is any other reason for bloating a stomach.
Mm-hmm. Yeah, very good.
You.
Thank you for your question, Sharon. Mary Thomas.
Yes, thank you so much for being here and helping me so much. But I wanted to ask, if I were to take just of all the things that you've formulated and I have diabetes and I have the inflammation of the stomach. Will you recommend the EMF or the probiotic?
Both. You cannot have one or the other. You
Okay,
have to have both.
okay, thank you.
Good question, Mary. Thank you very much. Susan Rucker. We're not able to hear you, Susan. Even though you are unmuted, we can't hear you.
Probably can log out and log back in, and she'll probably get her sound back.
Yeah. Look like she got a solution.
I forgot my microphone.
Ah, okay, go ahead. That will help.
Okay, I take the collagen in the purple bottle, but I'm a chronic constipated person, and I eat everything organic, and I don't take any other medicine. But what do I need to do?
I think sometimes that shows that intestine is not in a good health, even though we have a good diet. But maybe probiotic bacteria is not in a good amount or good shape. So try for a 90 days probiotic bacteria that we have, and that's supposed to help in a condition that you mentioned.
Okay.
And
Thank
if
you.
it doesn't go away, then you consult your doctor.
Okay.
Magnesium has been pretty good for helping.
Yeah, magnesium oxide, if you have it for a short term, if you take a 400 milligram of magnesium, sometimes people have a constipation occasionally, then magnesium oxide, because magnesium oxide is not absorbed, and therefore it
Just
acts
kind of-
as a laxative, and you will have it immediate within a few hours, not few hours, within 5-6 hours, you will have a bowel movement.
Okay. Thank you.
Magnesium oxide, make sure it's magnesium oxide.
Okay.
So in that case then, Dr. Prasad, in that case, when folks are having that issue, if they can now start to have normal bowel movements, or at least some bowel movement, that's forced with the magnesium,
Mhm.
will eventually their gut biome start to normalize?
Yeah, exactly. And then you don't need it. Yeah.
So after a while, you wouldn't need it at all.
Yeah.
Excellent.
You can't have every day, but for a few days you can if you have a constipation, and so. But once the gut health gets renewed, and then you would not need because vagus nerve created inflection, then your movement will start happening because the gut is not moving.
Right.
The movement of the gut is not happening, and that's why you have a constipation. So. Do you take a lot of fiber?
I don't take any fiber.
No, I mean it's like fruits and vegetables.
Yeah, I eat fruit, vegetables every day. I eat a green smoothie with kale and broccoli, spinach.
So that means that your intestine is not very happy. So probiotic will be good to try.
Okay, and how long should I do the magnesium for?
You just take it one day, and then next day you will have a good bowel movement.
Oh, okay. Thank you.
So it'll move things along, and then eventually you won't need it at all. So you just kind of monitor it. You dial it down when you won't need it anymore once your bacteria gets normalized.
Okay.
Yeah.
Thank you so much.
Sure.
You're very welcome. Thank you for asking your question. James and Angelique Greer.
Hello.
Either or. Hello, Angelique.
Hi, thank you. Thank you, Dr. Prasad.
Sure, thank you.
I just wanted to ask a question. On one of the slides, it mentioned something about the vitamin K.
Mm-hmm.
Does that include, what does it do? And does that include vitamin K too?
No, I think the most of the vitamin K1 and K2 you take from vegetables and fruits, especially from green vegetables. And the bacteria during fermentation process, they produce a vitamin K2, a small amount. And vitamin K2 is very much important in a clogging, blood vessel clotting. I don't mean clogging, clotting mechanism. So you need a small amount of vitamin K2, but you don't want too much because
micrograms.
Yeah, micrograms. Yeah, and that you don't need any supplement, because if you take a vegetable or fruits, and if you have good probiotic bacteria, that's enough, provide enough vitamin K1 and K2.
Does the probiotics also, I know it helps with the gut, the brain. What about the heart?
Heart? Well, heart, I mean, if you're healthy, suppose if you're taking micronutrient and probiotic alone can do all good health. It will help. But if your gut is healthy and if you're taking a micronutrient, it will absorb better, it will go to your heart, it will go every place else. But there is no direct connection like gut and brain axis or gut and lung axis. There is no direct connection with the heart. But if your gut is in good shape because of probiotics, everything, food or nutrient or supplement you take, it will be absorbed better, and it will go all to your all organs, and heart will be healthy.
The reason I'm asking is because, well, somebody I know, their heart, the doctor said their heart was hardening. The heart itself, walls were thickening and hardening. But they are taking the micro daily and the collagen. So
yeah, I mean, it looks like when they started it, but I don't know if it is the artery is thickening or it is the muscle of the heart is thickening. That is a serious disorder, and of course you have to consult your doctor. But in this case, micronutrient is meant to help you, and and there is no data, human data, that if you take a probiotic, what impact it will have on heart, but it will not hurt you, and therefore it will be worth trying it and make sure that you are under care of a cardiologist and tell him what you are doing.
okay, thank you very much.
Sure.
Excellent. Okay, we only can take maybe one or two more here. We're just past our cutoff time, but we can take. Let's take this. How about we take this last one, Dr. Prasad? Is that okay?
Okay, fine.
Athena's S20.
Hi, I apologize. I can't put the video on right now. I'm currently nursing my baby I just had on Monday morning.
Okay.
Oh, congratulations.
Thank you so much. And thank you, Dr. Prasad, because I am producing milk like crazy.
Oh,
First and
good.
foremost. My question is he inherited polycystic kidney disease from his dad. Is there any way this will help?
Yeah, it will help. I mean, since you are taking it, and it might help him, because cystic fibrosis is a genetic problem, and it is not the genes, but it is the protein they produce it. And if you block the action of the protein, then it will happen. In many cases, it has happened, but I don't know in case of cystic fibrosis it will happen, but it will not hurt him.
Not cystic fibrosis, polycystic kidney disease.
Yeah. I mean, any kind of genetic disease, and we wrote a review article, not on that particular genetic disease, where we showed that they generate a lot of free radicals, this gene defect, and that causes inflammation. So micronutrient can help to reduce those things, therefore delay the onset of the disease. Instead of early onset, it could take 40, 50 years to develop one. Nobody has done human experiment, but this is what it looks like.
Okay, so if I add that with the micro daily, it can help the baby since I'm nursing?
Yeah, nursing is okay. Yeah, you can take micro daily nursing. There is no ill effects.
Okay, thank you so much.
But just take it 2 in the morning and 2 in the evening.
Okay.
That is just,
Thank you.
it's wonderful to hear this kind of thing. So, so Dr. Prasad, you're just loaded with all kinds of information here, and the research that you're doing it's always overwhelming for us, and we can't thank you enough for providing us sharing what you know with us. And we still have a hard time. We're going to have to ask you one day to bring your birth certificate and prove that you're actually 87 years old, because it's getting more and more.
3 months I will be 3 months I will be 88.
In 3 months' time, he's going to be 88 years old. So this is just mind-numbing. Well, you keep it up, and just thank you
Okay.
for helping us. There's a lot of folks, Dr. Prasad, that.
Oh,
that-
yeah, I'm glad. And we will do it again whenever you need to.
We're going to bring you back on, hopefully in 2 weeks. So we'll
Okay.
have that conversation. So if everybody would like to join us again, make sure that you kind of put that on your calendars. We'll be getting back
Yeah,
with that.
I will get to answer some of the questions they have. So,
Yeah, and if you have any other questions that we haven't had, you can always, again, post them in the chat or send me an email or get back with the person who invited you to this discussion, and they'll know how to channel the questions on to Dr. Prasad.
yeah,
Now,
and
this-
I respond promptly.
This coming Tuesday, Tuesdays and Thursdays, I have discussions on this same channel. So you folks are welcome to join us. Tuesdays at 7:30 and Thursdays at 6 o'clock. And all throughout the week, Dr. Piccola Roberts has Lunch and Learn at 12 noon Eastern Standard Time. So just about every day of the week, you have opportunities where you can learn something about and build on your knowledge base with these amazing products. You have someone that you want to introduce these products to, we're more than happy to share what we are learning from Dr. Prasad with them. So just make sure that you get in touch with us, connect with us, and we'll be happy to do that. So you can check the chat now, and the link, the Zoom ID code, I don't think there's a password, but the Zoom ID code is posted right there in the chat for Lunch and Learns every day during the week at 12 o'clock noon. And the same channel that you came to today, the same ID and password today, Tuesday, 7:30, Thursdays at 6 p.m. Okay? So thank you folks very much again for joining us. For those who are who would like to stick around for a few minutes, we're going to have a brief business meeting. It's going to take about 30 minutes or so. So anyone who's interested in the business, you're more than welcome to stick around and join us for that. So for everyone else, you're more than welcome now to unmute and thank Dr. Prasad.
Thank you, Dr. Prasad.
Thank you, Dr. Prasad.
Excellent. Thank you, Dr. Prasad.
Thanks so much.
Thank you, everybody. Good job, everybody. Good job.
Thank you.